Morning. We are working on Christian mental health, and this is the sixth class, eating disorders. Eating disorders, well, some people can misunderstand this, because eating disorder, well, why you don't eat? Because you feel bad, or you have teeth problem, or you have swollen tongue, or inside of the mouth. What's happening? Well, those can be eating problems. When you have teeth problems because of the decays or cavities, you just pulled out the wisdom teeth, or you have kind of tongue problems because we have something infection, so you have you need antibiotics or something, then it's gonna be very hard for you to eat. But those are eating problems, but you don't want to say that is eating disorders. Eating disorders is kind of a mental problem, psychological problem. Okay. So eating disorders, why people can't, or why people eat a lot, why people can't eat, they refuse to eat, because it's not because the food are bad, but because they cannot eat, or they are not willing to eat, because eating itself is painful to them. They are not interested in eating, or somehow they don't want to eat and refuse to eat because of the mental problem, because they don't feel to do it. Or some people eat a lot, or some people eat particular food like vanilla ice cream. I think I just mentioned that in this class. Do you remember that I just mentioned about the more than 300 pounds woman? She only ate the vanilla ice cream only, nothing else, no bread, no juice, whatever, just vanilla ice cream. So those are eating disorders. Why people are having eating disorders? It's kind of painful to watch those people, because what if your kids don't eat? What if your parents don't eat? It's gonna be painful. Well, lots of parents, this is kind of a different story, but lots of parents are kind of struggling with their kids, because their kids don't want to eat properly. They don't want to eat good enough. So that is a big problem for most parents, because it's happening to many families. Well, for me, I don't know if that is right or wrong, but I used to always put a nice dessert like yummy cookie, or yummy jelly, or yummy pie, cake, or something sweet, a little bit, not much, or just fresh fresh fruits like apple, or orange, tangerine, strawberries, and raspberries, blueberries, something like that, on the side of the table. That's for our dessert. And I used to serve food to my kids, and if they finish it, they have enough room. That means they have enough room for dessert. If they don't finish their dishes, that means they don't have enough room for dessert, because they are full, so they couldn't finish their dishes. Well, sometimes it is too much for kids, so well, I just admit that. So my kids just complained later on that it's too much. So if that is too much, let me know. I'm gonna just make it just to serve good, you know, you know, just as much as you want, and then you finish it. You can have dessert. You deserve it, right? So anyway, that was my solution when my kids were younger, and so I don't want to just take it. I mean, it's okay. They do their food, and they eat it, or they order or something. So I think it's okay. So I don't I don't just set a table for lunch or dinner or breakfast for my kids, because our eating times are all different, and we are just eating whenever we are hungry. So now, because they are alert, and I don't have to, um, you know, take care of them by serving food because they are alert. But I did that. Anyway, eating disorders, but somehow kids can have eating disorders because they don't want to just eat. Not because they don't like those food, but they are not willing to eat because they are sick in their mind. Their mind is something is happening in their mind, in their mental, so they don't want to eat, or they eat a lot because they feel something empty or something wrong is going on in their mind, so they don't want to eat, or they don't want to they want to eat a lot. Okay, so I don't know. Lots of Americans have obesity, and some of them can be because they are eating not good, right? I mean, no good food, junk food, or something like that, or they have mental disorders. So, roughly 1 out of 6 Americans have at least minor mental disorders. So those can be related with them. So that is kind of a big problem nowadays. And eating disorders, for example, well, I just read an article a couple of years ago about how they look. That's what happened in that was research in Korea. Definitely sounds, and the research was about asking, how do you look? How do you think your outfits or your body? And lots of women, Korean women, thought that they are kind of overweight, but actually most of them were standard and a little bit lower than standard, but lots of women was thinking that they are overweight. That's crazy. Old people. I don't know why Korean women want to be that skinny. They are not models or something, but I think that they were trying to look good, but they got misunderstanding, or they have kind of wrong standards, so they don't think they what is you looking good or not. So, well, for me, I don't like skinny too much, on the way to the people, whether they are women or men, because at least they don't. I think they don't take care of themselves right. Well, overweight people, they don't take care of themselves, properly. I think both are wrong, but anyway, you know, they problem is that lots of women were thinking they are overweight, but actually they are not. That was the problem. So we want to just work on eating disorders, and that is kind of a big topic nowadays. So eating a lot or eating quite less, that is, a big problem in this society, because Americans are eating a lot, eating too much, eating a lot of junk food, and African Americans, they are starving to death. They are dying because of the starving, and some people are thinking they are eating a lot. Some people are thinking they are not eating, good enough food. So, well, those are big problem. Eating disorders are serious mental illness. Yes, that is mental illness. It's not just eating problem, but eating disorder. As I mentioned, they can affect people of all age groups. Whether they are young or old, and genders, men and women, and backgrounds and cultures. Okay, the number of people with eating disorders is increasing. Well, I think that is reasonable, because lots of people are having under mental disorders more. So mental disorder is increasing, and eating disorder is increasing also. So we understand more about eating disorders now than ever before. Yeah, many people live with these disorders for a long time without a clinical diagnosis or treatment, because, well, you're eating good, even though they are obesity, or they are eating because of something, in their mind. Okay? Eating too much is a problem. Okay. Eating quite less than normal is big problem too, right? But we are thinking, oh, you are skinny, you are, obesity. You don't talk like that, but you think like that, but you don't know what's going on in them, in their mind. Okay. So somebody has eating disorder, but you wanna just think about what's happening to the person, okay? And you wanna see whether they have a mental disorder or not, right? Female adolescent and young women are most commonly diagnosed with eating disorder. Male and gender diverse people also experience eating disorders, and are often underdiagnosed. Eating disorders are estimated to affect almost 1 million Australians, because this research is done in Australia. And I'm just borrowing the research results and studies for this class. Well, eating disorders is the same to America and Canada and most European countries. Those are same. They have these eating disorders, but they don't take it seriously, or they don't know how to take care of that. So they don't want to just get diagnosed properly. And because they don't know what's going on, because they haven't got any diagnosis because of the eating, so they don't know what's going on. Okay? If you know that you caught a cold, or you caught the coronavirus, and then your treatment can be different, right? You need to take different medicines, and you need to take different exams. You need to take different food, or lifestyles, and something like that. See, those can be similar, but the treatment wise, those are pretty different. There are big difference between cold and coronavirus, right? Same thing. We have lots of eating disorders, but they don't know what's going on because they haven't got diagnosed. They don't know what it is. Well, people can say, "Oh, he's eating a lot," or she's eating quite less. And but there are something else, but you don't know it because you don't because they are not diagnosed properly. Then how are you gonna just try to help those people without knowing what's going on to them? Okay. All right. But eating disorders, millions of Australians are struggling with eating disorders. It's more Americans are affected by eating disorders in many ways. Okay, and it's happening to young children, to old people, right? A friend of mine, his father decided to fast because he knew that his time is coming to die. It's kind of a suicidal event, but he knew that he's gonna die, or at least he decided to die himself. Die. So he decided not to eat, and he fasted. I think a little bit more than a week, and he passed away. Well, I don't know if that is proper or not, but that was his father's decision. Well, nowadays, some European countries are providing kind of, dying service or killing service. I don't know what it called, but kind of providing the chance to die with dignity, because when you have a certain disease, and for example cancer or not something, but you're gonna die anyway in 2 months or 3 months, and then they don't want to just spend their life in the hospitals or see ICU, intensive care unit, or in the emergency room, and they decided not to take any chemotherapies or whatever, or surgeries, but they want to just enjoy their last moment with their friends and families, and they just travel to Europe, country which is providing that kind of service, and they have parties and they spend some time and they watch their loved ones die in that organization in a special chamber. Well, but that eating disorders can be related with that, but eating disorders, even though people can decide not to eat, and they can refuse to get kind of injecting that kind of food supply tubes and lingers, and they can decide they can they can fast. but that's kind of tragedy, but that's what's happening in this world right now. The most common risk factors for the onset of an eating disorder. Onset means how it can start, okay? What triggers that eating disorder? So, most common risk factors, body dissatisfaction. Oh, I'm too skinny. Oh, I'm too fat. I don't like my body shape. This part is too big. This part is too big. Or this part is too thin. And dieting? Well, lots of people are misunderstanding what the dieting is. And some, fasting is the most popular one for dieting. But diet means eating, Diet means eating. It's not fasting, diet means eating, okay? So digest. Digest means for, kind of metabolism or something, right? Digesting. It's kind of eating, right? But people are thinking, I wanna just watch my diet. You wanna watch your diet. It means you're gonna eat right. It's not mean fasting. You don't want to eat? No, well, fasting can be part of, I don't know if that is part of dieting or, I don't know. Anyway, dieting. A friend of mine, his family, one of his families, just watching his diet for many, many years. I have heard that diet for 20 years, but he's about the same, or he's getting more weight. What? Anyway, lots of women, especially women, some men too, they are trying to watch their diet, but it can be onset of eating disorder too. Depression. When we worked on depression, we could understand, when people got depression, they can eat a lot or they don't want to eat. Okay? So there are two phases, how they can express or how their symptoms can be, shown. But anyway, those are most risk factors. There are some warning signs that are common to people with eating disorders. Okay, warning signs. Okay, weight loss. Yes, you can see it, right? Weight gain. Yeah, you can see it. Weight fluctuation up and down, usually due to dieting, because of the eating less or eating a lot more. But sometimes from an illness or stressful situation, when you got sick, well, when I caught a cold, that was kind of severe one. So that was actually severe flu rather than just common cold. So I had to spend 2 weeks on my bed, and when I just look at my body, I got shocked because my legs were skinny. Oh my goodness, that was the most skinniest moment in my life. I'm gaining a little bit, and my legs are a little bit thicker than before, and I'm trying to make 2 legs stronger than now, but I'm kind of lazy. So, but when I just saw my body, I got shocked. Oh my goodness, are those my legs? Or stressful situation, you don't want to eat. When you got stressed, people don't want to eat. Well, some people, well, most people want to eat more because they got stressed and they want to just release their stress. So for that, they want to just eat more sugary things naturally. Okay, that's natural. Preoccupation with the body appearance or weight. Okay, or sensitivity to cold. So when people feel cold, you know, it's not that cold, but people I think it is too cold for them because they have lower blood pressure in most cases, and then they they can eat more or less. What when they I think skinnier people feel more cold, right? So you can just see those are signs. Faintness, just got faint, or dizziness, oh my goodness, or fatigue, you got tired, and those are warning signs of eating disorders. Why? They they don't eat properly and they need more nutrition or sugar level is too low so they can feel fatigue, they can feel dizzy, and they can feel faint. They just sometimes faint. Increase the mood. So when you have high blood pressure or something, people usually carry candies. So when they feel they are dizzy because of the sugar level is low, and then they just put a candy in their mouth and they're gonna be okay in a minute usually. But when you don't have proper food, then you need more sugar. You need then you can feel the same things. Increase the mood changes and irritability. They are pretty sensitive, and they they were very bright and outgoing, but they don't want to just go outside, but they want to just stay in their room or in the house or something, and you can see those are warning signs. And social withdrawal, you don't want to meet people, and because they have eating disorders, so they are eating a lot or they don't want to eat, so they don't want to just see people that are eating a lot in front of other people, and or they don't want to see their skinny bodies, or they don't want to eat, so they don't want to be with their friends. Because whenever we meet our friends, we eat, right? And anxiety or depression, so they got those kind of signs, and then we can guess, if they have eating disorders or not, because that's part of mental disorder. And inability to think rationally or concentrate, they cannot concentrate. They can think rationally, so they just think something crazy. Or increase the interest in preparing food for others. So just they can invite others for, providing more food, and then that person can eat more. Obsessive rituals such as only drinking out of a certain cup, you have your cup and you just use that cup only. You don't drink without the cup and outside. Eating in secret because they don't want to show, what they are eating. So usually obesity people, they can, all depends on, but some people they just hide their food in here or there or everywhere, and they eat wherever they go. They eat, or wearing baggy clothes or changes in clothing style. Some people used to wear kind of tight or fit clothes, but they don't. They want to wear the baggy pants or shirt or something big, because they don't want to just get their fat body printed. Excessive or fluctuating exercise patterns, okay, and avoidance of social situations involving food, so they don't want to meet friends. Frequent excuses not to eat because they don't want to eat. They can't eat because they have a mental disorder. They under big stress. They have something problem in their mind, so they don't want to eat. So they excuse frequently. Disappearance of large amounts of food from the refrigerator or pantry. Just bought lots of food from the market, but you can't see in the freezer cause somebody took it or ate it. Then that's gonna be the warning sign that you have eating disorder person in your home. Trips to the bathroom after meals. Why? Well, we want to just take a look at the types of eating disorders, but some people want to eat a lot for their satisfaction, but they just worry their body shape. So after they eat a lot of food, they just run to the bathroom and they put their fingers in their throats and you know what it is. So for those kind of people, when you see their hand, you can see particular fingers got kind of more scars, scratches, because they usually use that finger for throw-ups. And constant and excessive dieting, they eat 24 hours, okay? They eat, they don't stop eating, and those are warning signs. Then we want to just take a look some types of eating disorders, because there are some types. And anorexia nervosa, that's characterized by restricted eating, weight loss, and fear of gaining weight, so they don't eat. And they people who are doing this. And bulimia nervosa, that's periods of being binge eating, often in secret, okay, followed by attempts to compensate with excessive exercise, vomiting, or periods of strict dieting. All right. Binge eating is often accompanied by feelings of shame and being out of control. So they want to eat, right? After the diet or exercise, they want to eat, but they just fear that people can watch them. They are eating because they are thinking eating is kind of shameful or sinful even. And so they don't want to show that they are eating to others. So they are eating secretly, all right? Binge eating disorder, that is characterized by recurrent periods of binge eating. Binge eating can include eating much more than usual, eating until uncomfortably full, eating large amounts when not feeling hungry. So they just eat, all right? And they just eat, and they just eat more. They don't care, what their stomach feels or something. They know that their stomach is full, but they keep on eating. Okay, that's binge eating disorder. Feelings of guilt, disgust, and depression can follow binge eating episodes. Because after they eat lots of food constantly, and then they feel guilt. And binge eating does not involve compensatory behaviors such as bulimia nervosa. Alright? So that's the difference. Bulimia nervosa is eating secretly and they feel, kind of shame. It's kind of because out of control, right? But the binge eating is kind of it's not involved with compensatory behaviors. Oh, because I had exercise, I want to just eat. That's bulimia nervosa. But binge eating, it's not compensating because that's eating. Okay. Other specified feeding or eating disorder or SFED, feeding or eating behaviors that cause the individual distress and impairment, but do not meet the criteria for the first three eating disorders. Okay, that's eating disorders, but you can name the three types of eating disorder: anorexia nervosa, bulimia nervosa, and binge eating disorder. And then bug is flying, and then you can say that is OSFED. There is no single cause of eating disorders. A number of factors combine to cause them. So, well, you got a shock because your boyfriend or your girlfriend told you that you are getting weight or you are kind of too skinny, something. Then, well, you're gonna get shocked and you're gonna get mad. Actually, we usually don't say that, right? But anyway, that can be stressful for those people. Socials, but just one thing cannot. I mean, one thing does not usually trigger eating disorders because in general, it can be, but in general, eating disorders have more than one cause. Okay. Social, psychological, and biological factors all play a part in varying degrees for different people. So social problem and psychological problem or biological problem, those are factors that can work together for eating disorders. Alright, then what kind of social factors can affect to eating disorder? Contributing social factors may include those media and other presentations of the ideal body shape as lean and fit. When you watch, well, people don't compliment fat people, right? But it does not mean that they don't, they don't judge standard weight people. Well, actually, most models are skinny. They are underweighted people. Because fashion designers and models and medias are thinking that skinny people can present their clothes better. Well, some and few companies are making kind of baggy or extra large size clothes and swimming suits or something like that for for the big people. I mean, but in most cases and most designers, they want to just have skinny models for their clothes because they were thinking actually those are looking good. But when you watch those things, And when you understand why this society and this world is, they like skinnier people rather than normal or overweighted people, and you can get your own standard, right? And in most cases that can be lower than the standard, so they want to be skinnier than normal. And pressure to achieve and succeed because they are thinking that is successful, and you don't see kind of overweighted presence in this world or something like that, because people are thinking overweighted people are lazy and they can't control themselves or something. They're not patient or they are greedy or stupid. That's what people are thinking, even though that is not true. And peer pressure to be or behave in a certain way, because when you just eat with your friends who are vegetarians, or people can eat this. I mean, we can see kind of overweighted people who are from the vegetarians too. But anyway, when you just see and eat with your friends who are skinnier than you, and a cultural tendency to judge people by their appearance. That is quite important. We actually all cultures judge people by their appearance. I mean, in certain tribes and countries, they think kind of overweighted people are more beautiful, so they eat a lot and they try to eat a lot. I just watched that kind of documentary, so but in most case, for them, you have to eat and get fat, because that means that is beautiful, right? Then it's gonna be very hard for you to eat more food, because you naturally don't want to eat that much, and it's gonna be very hard to move around, and you're gonna get sick, because you have more chance to get more disease, high blood pressure and diabetes. Those are all cultural disease, right? Especially high blood pressure and diabetes and obesity too. But that can be cultural tendency to judge people by their appearance, and occupations or activities that emphasizes a particular body shape and size. For example, ballet, modeling, gymnastics, and elite sports. Have you ever seen any overweighted people except weightlifting or certain sports, because they it's some sports have can the overweighted people can favor from a certain sports like throwing or lifting or something like that. And major life changes or events may also contribute to the onset of an eating disorder, including relationship breakdowns. Well, when you just break up with your boyfriends and girlfriends, and people they wanna just eat a lot, or they just refuse to eat because they got shocked. It's kind of painful, right? And pregnancy and childbirth. After they divorce their babies, most women, just they worry their body shape because they, in general, they usually get lots of weight while they are pregnant. Okay, because they have to eat more, and they want to eat more because their babies need more nutrition. So that's natural. What if their mothers don't eat and the babies cannot eat properly? It's hard to send nutrition to their babies. And the death of a loved one, as I mentioned, when you lose your wife and husband and people usually, and you don't want to eat, in most cases, or you want to eat a lot because you want to just overcome that pain, right? That is, and eating disorders can also be triggered by accumulation of many minor stressors, such as, okay, you don't have a big events, but when you have a little events, often, okay, like a few of the responsibilities of adulthood. Okay, after the adolescent, they realize that they have to take care of themselves. So they have to make money, and at the same time they have to study. Okay, work and study. And after their study, they have to take care of themselves, and then they have to pay their cars, they have to pay for insurance, housing, food, clothes, and fun. But at the same time, they have to plan for their futures, and those are very stressful for those people. Okay, a belief that love is dependent on high achievement. Okay, so when they are successful in a certain area, and then they can love, or if they are not successful in the near future, they're gonna lose their loved ones or something. If that is what they are thinking, it's gonna be very stressful. And when people are not stable, they usually eat a lot, or they don't want to eat food or something, or they eat a certain junk food or whatever. So when people are under big stress, I don't see people want to just eat good food like organic or whatever, because they don't care those things, and they want to just eat sugary, dirty, food. And poor communication between family members. Okay, when they don't have kind of active communications with their family members, they don't want to eat. They eat a lot. So those are problems. And well, life is not easy, and people know that, whether they are young or old, or parents and kids, there are, moments they feel and think the life is not easy for them, but anyway, and then they are vulnerable for the eating disorders like those. There are biological factors too. Contributing biological factors may include adolescence and it's associated with physical changes. You know, that's the big moment for their body change when they, adolescent, and they know, they got lots of smells from, and they got lots of hairs in here or there, and they know they are having pimples or skin changes and characters and voice and body shapes are changing a lot. So that and hormones, and those can trigger the eating disorders too, and they are very sensitive, for other genders, and they want to just see how to have good relationships, or how they can have be more attractive. So they are very sensitive to their bodies. And generic or family factors, for example, families that are overly focused on food, weight, shape, and appearance, and usually when their parents think, I should think you eat too much or something, those kind of mentions, or eating too much, how come you don't eat, or something, those things. And the siblings can compete, and they want to just judge each other's, and because siblings are cooler than people, people are very generous to other people, but their family members, they are very honest to their family members, and they can make other family members hurt. Okay. And psychological factors, sure there are psychological factors. Well, the psychological factors can affect the eating disorders, but those factors, which are triggering eating disorders, can produce the psychological problems, and eating disorder is psychological problems too, though. So sometimes it can be confused that which one comes first or later. But anyway, there are psychological factors like low self-esteem. You think you are losers and you are useless, and you feel that you are inferior, or you don't find any good things for you, and you just think your future is gloomy than sunny, then you have low self-esteem, and because you have low self-esteem, you don't want to eat, or you eat more, or negative body image. Your body is perfect, but you don't think your body is good, looking good. So your body is too fat, your body is too skinny. Perfectionism, you want to just be perfect, and you want to just keep your body weight standard. Oh my goodness, and you got in trouble, and you are killing yourself actually. Depression, anxiety, impulsivity, and obsessive thinking, difficulties expressing emotions. And those are psychological factors, which can trigger eating disorders, because you are not comfortable. You have no peace in your mind because of those. When you have those kind of factors in you, do you think you can find any peace in you? That's gonna be a very painful moment, because you know what it is. If you think you have an eating disorder, then what's gonna do? And many people have problems with their eating. If you do have an eating disorder, it's important to seek help. if you know that you have eating disorder, based on the knowledge we, took a look, and then you don't understand that you are sick, you need help. When you caught a cold, you have a runny nose, you have a fever, you are tired, you feel cold, or you feel hot sometimes, you can eat, and you know that you caught a cold. Then you go see your family doctor. It's the same thing. You wanna just see your doctor when you think you have the eating disorders because you are sick. And remember that with the support from health professionals, eating disorders can be recovered from. Yes, it can be cured. You're gonna get a lot of help from your professionals. Health professionals. And you can be free from your eating disorder. Getting professional help and support from others is important because when you got addict to, alcohol or caffeine or something, or YouTube, how do you know that you have a problem? Can you diagnose it by yourself? It can be hard, people are thinking that they're okay, or they can overcome, but they can't, and they are staying there. They got stuck there. So you want to just ask the, health professionals help, and getting professional help and support from others is important. You want to just don't diagnose yourself with, by some YouTube clips or some internet knowledges, and those can be helpful sometimes. But what if they are not, giving you the right information or something? You got in trouble. And recovery may be slow as you learn to approach the food in a more positive way and understand the reasons for your behavior, but the effort will be worthwhile. Well, most mental disorders, the onset at the time, the severeness, condition. The mental disorders can be triggered slowly, and this is gonna be the onset, okay? And then, before the onset, you can't say you got a problem. You can be diagnosed, but this is the time you can be diagnosed as this eating disorder, and it's going to get worse, getting worse, right? So when you recover from here, it's recovering. What's this? Oh my goodness, what is this? Okay, and then recovering can be slow too. Okay. But the demo position can trigger suddenly, and it can heal suddenly. Okay? So when demon possess somebody and it triggers here, that's onset, okay? Suddenly. And it can be healed suddenly, okay, right away. When the demon passed away by Holy Spirit or something, and then you'll be okay right away. Okay? It's gonna be onset right away, it's gonna be recovered right away, but mental health problems usually takes a long time to get onset and to be healed. Right? It takes a long time, but it is worthwhile. It's family and friends of someone with an eating disorder and what they're gonna do. Parents, siblings, partners, friends, extended family, work colleagues, and others often experience many different feelings as they learn to cope with the effects of an eating disorder on the person and on their own lives. The strain of living with a disorder can create tensions and divisions within a family. There may be feelings of confusion, grief, anger, guilt, and fear. Because of you, I got, this kind of disorder because of you, because of you, And family and friends can remind their loved one that the effort associated with recovery will be worthwhile for everyone. So it's definitely, when a person, when a person in your family members got eating disorder, all people or family members are gonna get stressed because of that. When the person can recovered from eating disorder, all family members can be happy, Definitely. The most important thing is to show love, care, and faith in the person and seek advice at the earliest possible time. The earlier the better, right? Some suggestions for family and friends include be honest and open about your concerns. I'm worried about you because you have that disorder. I'm paying for something, or I'm feeling sorry for that, or something like that. Use I statement rather than you statement. For example, you know what it is. Say, I'm concerned for you because I have noticed you don't seem happy at the moment, rather than you aren't happy at the moment, and focus on the person's behavior rather than their weight, food consumption, or physical appearance, and you just focus on. I think you don't want to eat this much because you like it, but you don't want to eat this much because it's gonna be toxic for you. Okay, you don't want to just say if you eat more, you're gonna get more fatter than you are already fat enough. Or don't, right? I'll try to take the focus off food and weight. The person with the eating disorder is already likely to be excessively focused on food and weight issues. So, food and weight, and you don't want to just focus on something else. And meal times should not be a battleground, so don't fight and don't push to feed them, or don't just ban certain food or a certain amount. Or frustrations and emotions need to be expressed, but not at meal times, which are already likely to be difficult. As much as possible, the things as you usually would, the person with eating disorder needs to learn to coexist with food and other people, rather than others learning to coexist with the eating disorder. And you want to just aware of it. Treatment and recovery for people with eating disorders many different forms of therapy are available. Okay, it is important to remember that different approaches work for different people. So you know how to treat. This is the treatment standard. It doesn't fit to all people. Okay, so it depends on the situations and people and characters and conditions. You want to just use the treatment skills. It's gonna be a customized treatment skills to each people. And finding the right approach and early intervention maximizes prospects of recovery. Professional help and support from others is important. So those are valuable. Because of eating disorders affect people physically and mentally, range of health professionals might be involved in treatment includes psychiatrists helping here, psychologists and GPs, general physicians and dietitians and social workers, nurses and dentists, and those people can be involved for helping eating disorder people because for example, when a person have eating disorder because of the certain things, and they need counselors and psychologists and psychiatrists for medicines, and then because they because the person's weight is overweighted, and it can trigger lots of physical problems like obesity and diabetes and high blood pressures usually, and lots of heart problems and something, and knee and joint ankle joint problems and backaches, and those are all related with general physicians can take care of, and then eating disorders usually involved with the dental problems and lots of things. So those all help can be involved for helping eating disorder people. So when you want to help eating disorders, and then you want to just think about in kind of three-dimensional way. So you want to just help those people in many angles. So the treatments can be more effective than just approaching only one way. So we need lots of help for helping eating disorder people. All right. I want to wrap it up. So eating disorders are getting popular, and that is increasing, which means we are getting more mental health problems in this world, and we could understand why, what are triggering that eating disorders, and how to approach and how to treat those people with eating disorders. And eating those disorders is pretty tough, and we want to just change, lots of things from inward and from outward. So mental health is kind of tough, and if that is solved by some pills, it's going to be easier, but it doesn't work that way. So understanding, especially the diagnosing the eating disorder, is very important for people because they don't understand what's going on to themselves. So I think that is all for the eating disorders, and we want to just work on something else with other topics next week. Okay? See you next week.